Welcome. Good to see you all here. Senator Fasano and I are here to talk about the package of bills that resulted from our collaboration that began last year in the 2014 session when we were working together on issues related to hospital regulation and acquisition of physician practices that resulted in Senate Bill 35 of the 2014 session. That was the beginning of our process of addressing what we see as the changing system of hospital and healthcare that is changing at such blinding speed in so many ways that it is difficult for us to have a regulatory climate that's appropriate. So this fall, we had, going back to the fall of 2014, we had extensive number of hearings through our healthcare roundtable process that has resulted in a package of bills that are being heard today. And as we've seen across the country, there's a pattern of anti-competitive practices that have resulted in increased costs for consumers. And through this package of legislation, it's our hope that we can ensure that Connecticut residents have access to affordable, quality health care, and look forward to continued bipartisan cooperation on this, and that we are concerned about the shifting healthcare landscape with things changing so quickly with proposed acquisitions, mergers, hospital practice acquisitions, and the rest. And our proposals aim to present comprehensive initiatives to reduce costs for consumers, to maintain access to affordable care, empower consumers to make the best health care decisions for them and their families, and support low-cost, high-quality providers to ensure continued diversity and competition in the market. So we are concerned about access to quality care, transparency in billing, and also making sure that the interests of communities are protected. So I'll turn it over to Senator Fasano at this point.
Thank you, Senator Looney. And I think what's interesting is I think this might be the first piece of major legislation in which leaders on the Republican side and Democrat side got together and have proposed it to a committee. And I think that's important two respects. One, it speaks to the change that's happening in the medical field as fast as it is happening. And number two, it shows that leaderships on Republican side and Democrat sides can get together and work on problems to help the state move forward. Senator Looney has pointed out, we have 9 bills that are out there, 2 of which are insurance that have already been dealt with, and the rest are in front of public health.
And we'll be testifying on those bills immediately after this press conference.
Correct.
Yeah.
And we'll have a PowerPoint which will go through each one of those bills. Senator Looney's going to do the introduction, and then we'll have a PowerPoint to go through each one. But the idea is to talk about the fact that health care costs are rapidly increasing. Why are they increasing? And what we should do to help corral those increased costs. In particular, what other states have done, Massachusetts, for example, Rhode Island, what's happening across the country, and what are the different ways that we can get ahead of this, even though I believe we started too late, but we can try to get ahead of this and try to get more control so the consumer can have better knowledge, we can provide better health care at super quality but lower cost. And that's really the efficiencies that we're trying to achieve. And right now, without these bills, it is the market conditions that are driving the atmosphere in our health care and the cost. And the idea as policymakers, we believe we can keep the quality of care at the standards that we've come accustomed to in the state of Connecticut, but get more control of the cost. And as policymakers, that's why we're stepping in to sort of change the dynamic, which really has no reflection or controls at the current time.
That's right. I'd like to just highlight, as Senator Fasano said, we have a large number of bills that are listed here. There are 3 in particular that just wanted to highlight. Senate Bill 809, an act concerning facility fees. And that is one we have heard a great deal of concern about within the last couple of years as more entities that used to be freestanding centers of one kind or another are required by hospitals, becoming part of a hospital network, and then all of a sudden are subject to a facility fee when the service is being provided by the same provider at the same location using the same equipment, but now all of a sudden is subject to a facilities fee. So Senate Bill 809 would cap facility fees at $100 and require insurance to cover the costs of facilities fees, and would prohibit those fees in certain procedures that can be performed safely in outpatient settings. Senate Bill 811, an act concerning parity in hospital sales oversight, would apply our state's conversion process to sales between nonprofit entities. And Senate Bill 813 would aim to make healthcare costs more transparent and make pricing available to patients. And that's an act concerning healthcare price, cost, quality, transparency. And that's one of the grave concerns, that we see that billing practices are often not transparent, that both for the patients and for those that may be providing for payment on behalf of those patients, it is often an impenetrable process, and we hope to clarify that.